Turner, docket number 1705881, count 1, first-degree murder. We, the jury, find the defendant guilty of first-degree murder as charged in count 1 of the indictment. Count 2, conspiracy to commit first-degree murder. The verdict reads as follows. We, the jury, find the defendant guilty of conspiracy to commit first-degree murder as charged in count 2 of the indictment. Count 3, criminal attempt first-degree murder. The verdict reads as follows. We, the jury, find the defendant guilty of criminal attempt first-degree murder as charged in count 3 of the indictment. And this verdict and jacket is signed by the foreperson of the jury, by the foreman, rather, of the jury.
And there we have it. Billy Ray Turner is going to be 102 years old before he is eligible for parole. We have some great guests we want to welcome in for some conversation about this case. And joining us in North Carolina, forensic criminologist Dr. Laura Pedler. And joining us in Atlanta, Georgia, Atlanta Magistrate Court Judge, criminal defense attorney, and former prosecutor Kimberly Bando. Great to have you both on the show today. Thank you so much for being with us. Judge, I want to go to you first, if I may, please. With this case, this was such a tricky one with all of the players involved. We had the unindicted co-conspirator. We had the mastermind, the evil mastermind behind the plot, Lorenzen Wright's wife, who the jury never heard from. And then we had Billy Ray Turner, the deacon, the church deacon and the gardener and the love interest of Shira Wright. And he wound up being convicted of first-degree premeditated murder. Judge, I want to tap into your criminal defense experience, if I may, please. Do you think his defense team did enough in presenting one witness who was an alibi witness as well for his defense in this case?
Based on the verdict, the jury wasn't convinced with his alibi witness, and they wanted more. And so it wasn't enough. That's why his client was convicted, and they probably should have gave the jury more, although they're not obligated to. But you do everything that you have to do so that you can help your client with his case.
Appreciate it, Judge Kimberly. Dr. Laura, I want to pick your brain, if I may, please, about the evil mastermind behind this case, Shira Wright. The jury never saw her. The prosecutor kind of characterized her as like a ghost that was sort of looming over this trial. And I think for people who are just fascinated with criminal law and the criminal mind, it's really hard for good people who watch this show to understand how somebody can do that to the love of their life, to involve other people that they love. You know, Billy Ray Turner was someone who was her love interest. Her cousin Jimmy Martin was someone she presumably loves and cares about. Help us understand that, if you would, please.
So when it comes to murder, it doesn't happen in a vacuum, and murder is most often conflict resolution for the offender. So in this case, there was a preceding conflict between Shira and the victim, and therefore, in order to resolve that conflict, she selected murder as the resolution. So when we have a murder like this, it's most often when it's pre-planned and staged this way that the mastermind, in this case Shira, she is aiming to benefit from the victim's death in some way. So you have conflict resolution and benefit going on here. And sometimes benefit just means that whoever the offender is angry with, that anger is sated, or it can be financial, or it can be to keep a secret. There's so many preceding conflicts, it's kind of endless. So when people say, I can't believe she could do that to her husband, of course they say that because in their mind, they could never conceive to do something like that to their loved one. But that is not who Shira was.
And Dr. Laura, a follow-up for you, please. If she's looking at it like conflict resolution, what about the question of, well, why not just get a divorce? If you're not happy in your marriage, why not just do that?
Yes, I mean, there's so many cases I've worked over the past 21 years. They're like this, where the question would be, why couldn't you just get a divorce? Because the benefit's not the same. If the benefit was the same, simply to get a divorce would have been the chosen resolution. But for some reason, she needed her husband dead in order to benefit the way that she intended to.
And the guess is money here. Judge Kimberly, I want to pick your brain, please, tapping into your experience as a prosecutor. You know, you formerly served in that role before becoming a criminal defense attorney and also a judge. Tell me, the state chose to go about it a certain way by not indicting Jimmy Martin, giving him immunity, by giving Shara somewhat of a deal, not a great deal, but still a deal nonetheless. She didn't have to talk. There was the charge of facilitation that she ended up pleading to, facilitation of the crime of murder. And we know through Jimmy Martin's testimony that she and Billy Ray Turner had the guns. They both were shooting, so she was more involved, according to what came in the court of law during this trial. And we know the state never chose to call her as a witness. They just hung their hat on Jimmy Martin's testimony. Tell me, watching it in an analysis role, was there anything you would have done differently in terms of case presentation from the state, how they went about with the dealing, and what witnesses they chose to bring in and why?
Yeah, I would have brought from the wife, because we needed to know, like, why, put the pieces together, help them with it, since she was this ghost of the trial. Like, give the jury what they wanted to know. Like, why would she do this? Why would the gardener and the friend, why would he also do this and participate with it? So I definitely would have brought the wife. And I'm assuming they didn't bring her because she wasn't going to cooperate in the way that they expected her to. I'm almost positive they reached out to her. But based on the feedback, because she's already in prison, she didn't have anything to gain or lose, so she probably chose not to participate. And if she did, it was going to be forced, and it probably would have tanked their case. And so it was better for them to just let her be and to get somebody who has full immunity to actually just tell everything the way it happened, because he doesn't have anything to lose.
Judge Kimberly, thank you so much. Right, exactly. I thank you both for being on the show today, Judge Kimberly Bando and Dr. Laura Petler. You're going to stay with us. When we come back, we expect things to be resuming shortly in the case in Ohio against Dr. William Husel. We are anticipating a rigorous cross-examination from defense attorney Jose Baez of the state's last witness, an expert in pain management. This is Court TV Live, your front row seat to justice.
Calibrate.com.
This is Court TV Live, your front row seat to justice. I'm your midday host, Julie Grant. We want to go to Ohio together now, to the Columbus area where Dr. William Husel was on trial being accused of 14 murders. We're seeing the state finishing up with its last witness. This doctor specializes in pain management. Let's watch.
I believe at this time we want to transition to the hospitalization of Frances Burke. Ms. Burke is her matter is reflected in count number 6. Dr. Schweiger, what was Ms. Burke's presenting problem?
So Ms. Burke presented with essentially an acute stroke, and it was determined that she had suffered a hemorrhage inside of the brain based upon the CAT scan. She had bleeding on the left side of her brain, and it was thought related to the fact that she had been placed on a blood thinner known as Xarelto, because earlier she had developed pulmonary embolism, clots going to her lung. So her doctors had put her on a blood thinner. But one of the known side effects is that if you have weak blood vessels in the brain or have chronic high blood pressure, it can result in a catastrophic hemorrhage. And that's what appeared to have occurred. Also, when she was admitted, around the area of the bleed, so not within the bleed itself, but almost as if you had a rim or a frame, she had significant vasogenic edema, which occurs from swelling around the brain.
Thank you. And I'm publishing at this point State's Exhibit 32H. Do you recognize this as your report in the Frances Frances Burke matter?
Yes, ma'am.
And did you review the medical records in the Frances Burke matter?
Yes, I reviewed the entirety of her medical record that was provided to me.
Thank you. What was her hospital course?
So she was seen by pulmonary critical care, Dr. Closure, who did a comprehensive evaluation, and he discussed not only the acute change in her mental status that she had, but also the associated weakness on the right side of her body. And then he talked about the fact that when he saw her, she was completely unresponsive. And in fact, he actually recommended that they turn off the sedating medicine at that point to further evaluate her neurological status, because she had some abnormal posturing that often is seen in patients with severe brain injury. So that was done. Obviously, they stopped any further administration of blood thinners, and they were going to evaluate her condition moving forward to eventually determine whether or not she would get a brain death exam to see whether or not there was any neurological function.
Okay, and did that exam occur?
No, there was never an attempt at performing a brain death evaluation, which would have included both an apnea test to see whether or not she was over-breathing the set rate on the ventilator, as well as a detailed neurological exam to confirm the absence of both higher cortical and brainstem function.
In this matter, did the discussion move on to her DNR?
Yes, in fact, Dr. Closure had a discussion with the patient's husband, George, and several of the family members. First, because he wanted to explain to them that he had communicated with the neurosurgeons about whether it was feasible or not to operate on her to control the bleeding, and that neurosurgery did not feel that she was an appropriate surgical candidate. There was nothing for them to offer, and that he felt that even if she were to survive the acuity of this event, that she would have a very poor long-term neurological outcome.
Doctor, do you have an opinion about the survivability of Mrs. Burke?
Yes, based on the severity of the hemorrhage as well as the neurogenic edema, her survival would be estimated to be less than 5%. So it was not zero. There was a chance that as the edema resolved and the bleeding resolved, that she could come out of the coma, but she would certainly have had significant residual neurological deficits, particularly on the opposite side of the body of the hemorrhage. Since she had already presented with right-sided weakness, it's very likely that she would have been permanently paralyzed on that side of her body.
Did you review materials pertinent to her matter about her affect and pain or level of sedation?
I did, yes. I reviewed the pain scores and the sedation score, as well as the Glasgow Coma Scale.
What did that review reveal?
My review of those documents indicated that at the time that she was admitted and throughout that she was essentially in a coma, which is not surprising given the bleed and the edema in the brain, and that it did not appear that she had significant pain.
Thank you. Do you have an opinion in this case about whether or not her course could have, or strike that. Do you have an opinion in this case about whether or not it would have been advisable to continue to pursue her medical options?
Yes, I do have an opinion.
What is that opinion?
So I agree with Dr. Closer's assessment that it was reasonable to make her DNR CCA so that if she actually experienced cardiac arrest during the hospitalization, that she wouldn't be resuscitated. But given that this was an acute event, meaning that she had bled secondarily to the medication, and that she had significant edema around the area of the bleed, it would require a period of time, again, as I would estimate, 72 to 96 hours, to definitively tell her husband that she was non-salvageable and not survivable, because one can be significantly surprised in these type of patients. Early in the phase of the intracranial hemorrhage, they can appear completely obtunded and that they're not going to survive. But once the swelling and edema go away, you can certainly have patients, as I said, probably a 5% chance of survivability. And if the family and the spouse are willing to accept the inherent limitations of that patient, that they would have some residual paralysis, then it certainly is reasonable to continue supportive care until the patient themselves declares that they're not salvageable.
And what happened in this case, however?
So again, in this case, Dr. Closure did appropriately discuss the change in the DNR status that was going to be placed, because he was also concerned that swelling could lead to brainstem herniation. That's when pressure in the brain can push the brain downwards and push the lower part of the brain through the base of the skull, which is a medical catastrophe. If that occurs, you can't survive that without immediate surgery. So then at that point, there was a call, and remember, he had made her DNR comfort care in an arrest, but then there was a note that was entered that day, January 14th, from Dr. Husel, indicating that in a discussion with the family members, it was decided to change her status to DNR CC, meaning that she would be made comfort care and that there would be progression to withdrawal of care after extubation.
Thank you. Have you reviewed the pain scores in this matter?
I have, yes.
I will be approaching the witness with